We will talk about honey health benefits and health risks. First, let's say about honey's most evidenced health benefits. It's wound healing. Honey improves wound healing. It has antimicrobial property because it has low pH and high sugar content, and honey creates hostile environment for bacterial and viral and fungal growth, so it has antimicrobial property. Also, it has anti-inflammatory property, and slightly it improves and reduces pain also, and it can promote healing, and it keeps wound moisture. And we have large meta-analysis. According to this, honey improves wound healing by 24% compared to standard medical care. So it's very important finding that honey is really effective in case of wound healing. But here is important point that you can't use homemade honey. You need medical degree honey because you need to this honey be sterilized, and all bacteria in the honey should be killed, especially Clostridium bacteria, to apply on wound. It's important. So medical honey is different and homemade honey is different. So when we say that wound healing is important property of honey, it's not about homemade honey. It's important point. Second well evidenced finding about honey is cough suppressant. It improves cough, especially when cough is caused by viral infections and when there is dry cough during respiratory infections like common cold, for example. Why honey improves cold and coughing? Because it creates protective layer in the throat, and it improves inflammation, it moistures throat, reduces inflammation, reduces pain, it has antimicrobial properties, and also honey increases serotonin production in the brain, which also further suppress cough. That's why honey is really effective in treat cough, especially in children, and we have many meta-analyses about honey's effectiveness in case of cough during common cold or other respiratory infections. And in many cases, honey is more effective than many OTC medications. But here is important point. You should avoid using honey before the age of 1. It's must. It's very important notion. It's very important finding. It's strongly advised not to use honey before the age of 1. Why? So in infants you should not use honey because of danger of botulism, because of danger of Clostridium botulism bacteria, which can multiply in the honey. Actually it can survive in the honey, not multiply. And when a person eats, especially if person eats a lot, he or she can be infected by botulism, and it can be fatal also. It's important. So there is important danger of botulism. That's why you should avoid using honey among infants. And what is the best regimen intake honey? It's 1 teaspoon twice a day for coughing, especially at night before sleep. One should be at night, one should be during the day. Third important finding about honey is knee osteoarthritis. Local and topical application on the knee. Honey can reduce pain. it happens because of honey's anti-inflammatory action and antioxidant action and pain relief action. But these findings is not consistent, and more research is needed, and it's weak evidence. Also, we have weak evidences about cardiovascular benefits of honey, where honey decrease risk of cardiovascular disease, including it increase HDL, decrease LDL, but these findings are very weak. Correlation is weak. Also, in case of fasting glucose levels, there is some studies according to them honey decreases fasting glucose level, but such evidences are also weak, and we can say that honey treats diabetes or honey improves insulin resistance. These findings are very weak, so we can be carefully when we state such important findings. Also, honey can improve inflammation in the body. It can reduce C-reactive protein, which is inflammatory marker in the blood. So, but these three findings are weak. What are the strong findings? Strong findings are that honey improves wound healing first, and honey improves cough suppressant effect. They are strong findings, and weak findings are osteoarthritis, reduces cardiovascular risk, reduces fasting glucose level, and reduces inflammation in the body. What is the optimal intake of honey during the day? It's around 20 to 80 grams per day, but we should mention that honey is full of sugars. Almost 80% of honey is sugar. Different types of sugar. It's fructose, part is glucose, and glucose is very simple sugar which directly is absorbed in our body, and we get glucose, and fructose is metabolized indirectly. It means it does not increase glucose level in the blood directly. That's why glycemic index of honey is not too high. It's around 70, while sugar glycemic index is around 70. So 60 is in case of honey, and 70 is in case of sugar, table sugar. It means that we can say that honey is slightly better than sugar, but we also should remember that such high fructose level is not good for our liver. So we should always remember high content of sugar of honey. It's around 80% of mass of honey is sugar content, different types of sugar like fructose and glucose. So we eat honey, we eat sugars. That's almost the same. About vitamins in the honey, vitamin content is very low. You get less than 5% of daily value of vitamins from sugar. So to say that sugar contains vitamins is not serious, and it's not significant for our health. It's maybe interesting, but it's not significant, this vitamin content. But what is important and significant is antioxidants. It contains flavonols, it contains polyphenols, and they are strong antioxidants. And to compare how strong antioxidant and anti-inflammatory property has honey has, is that we can say fruits are weak antioxidants. Most fruits are weaker antioxidants. In the middle there is honey, and strong antioxidant is walnut. You can imagine like this, that honey is better antioxidant than most fruits, but weaker antioxidant than nuts. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.